Dr. Patti de Blasio. She is an MD, an integrative doctor out of San Clemente, California. And she is very familiar with stem cell, with light, with GHK, because she has done that all in her clinic, her practice. This week, we will be talking, of course, about our stem cell technology, the X39. Dr. Patti, why don't you unmute yourself and tell us a little bit about who you are, what kind of practice you have, and we'll just start with that.
Okay, well, it's good to see everybody today, and welcome to this time. I love to share with you just sort of my personal experiences, and I'm not giving any medical advice or treatments. Those are always the disclaimers that we have to put out up front. I'm just sharing my personal testimony, which is pretty awesome, along with some of my patients. But I'm an MD, a medical doctor. I went to medical school as a second career. And one of my favorite things to share that I may not have shared with this group is that both my son and daughter are physicians, and they were ahead of me actually in medical school. So my daughter was 2 years ahead of me in medical school, and she and I had a very special time together when I was a fourth year medical student and she was a second year OB-GYN. And we worked on night float together, and she let me deliver 30 babies. And so that's my special thing. My son is an interventional cardiologist, and he was my supervising physician when I was an intern, and he was a cardiology fellow. So I think they inspired me to do something I'd always wanted to do, but thought it was too late. I was a music teacher for the first part of my life. And so when I went to medical school, I did that just so that I could sort of get all the learning and credentials, but I wanted to continue to do what I'd been doing sort of just as a layperson. And that was looking at all the different alternative and preventive forms of medicine. And so you don't really learn that in medical school, but at least I have those tools. And then I do functional regenerative medicine. I do it both at a clinic here in San Clemente, California, and then also I work with many other clinics around the United States and do quite a bit of remote work too. So it's great to be here. I love that I've learned about the patches, and thank you, Marcy, so much for having me here today.
Now, doctor, that you are in San Clemente as a regenerative doctor, an integrative doctor, how did you learn about LifeWave, particularly this stem cell activation patch, and why are you using it for yourself and in clinic for your patients?
Well, I learned about it through a patient of mine. I treat mostly patients that have chronic diseases that, seem to be difficult to manage and certainly get rid of. I have multiple sclerosis of the symptoms. I don't make that my identity, but because of all of that, I feel like I'm able to help people more and understand where they're coming from when they have long-term things, even though they're trying to live as healthy and great as possible. So I listened to one of my patients one day who was actually doing better despite many things we had been doing, and she was attributing some pain improvement for herself through a patch. And so she introduced me to X39 and IceWave, and my ears perked up because I have pain at night. And I thought, wow, I like this idea, but it sounds absolutely almost charlatan. It's, too good to be true. And so I began diligently to do the research behind it and listen to David Schmidt's many webinars and look at the research. And I became convinced that it was going to be very safe and perhaps it might help me. And so I reached out and began using that. And that was back last May.
Wow. And so let's talk about what this is that doctor's using. This is from the company LifeWave. It is the X39, and it is stem cell activation wearable light technology. Let's say that one more time. Stem cell activation wearable light technology. That seems like a lot to say, right? And then when you look at it, you realize how simple it is. Yes, it looks like a Band-Aid. It actually goes on like a Band-Aid. Look at this. It's sticky. And inside is white organic material. And that is organic crystal. And it turns out that we radiate a low-grade infrared light. And when you put this patch on your skin, it reflects your own light and activates a peptide in your body called GHK copper peptide. That peptide acts like a telephone to your dormant stem cells and says to them to start working again and start working like they are young again. Can you imagine? Start working again and start working like you're young again. Who doesn't want to be young again? I mean, I do. I would love to be. I thank you, Ann. Thank you for being with me on that. Who doesn't want to be young? I'd like actually the knowledge of my age, but I would love the skin of 20. Let's just be honest, right? So that's what this is. And it uses a technology, a light technology. This is a big word, but you doctors will know it, called photobiomodulation, light making change in your body. So this patch, through light, activates your body. This particular patch activates a peptide called GHK copper peptide, which in turn communicates, because our body communicates, pretty amazing, really, to your stem cell army to start working again. Because you see, by the time you're 60, pretty much your whole army's on vacation. They're not dead, they're dormant. They're just sitting around doing nothing because nobody's communicating to them anymore to start working. So Dr. Patti, I gave that as a very basic description. Can you explain a little bit about what GHK copper peptide really is, and a little bit about how stem cells really do act as honing birds? Like, give us a little more meat on this subject.
Sure. Well, I got into injectable peptides through regenerative medicine several years ago, and also stem cells. And so I had done so much research a number of years ago about this. And one of my favorite injectables for myself and for my patients that we were using was GHK copper. And that's one thing that when I heard the patches actually stimulate GHK copper and stem cells in our body, I was so interested, because that was my big area of interest. And what I've learned about GHK copper, it's just a short chain of amino acids. That's what a peptide is. And it literally is something we have in our body, just like stem cells, but over time and with stress and with aging and with illness, those diminish greatly in our body, our stem cells and our peptides. In particular, now we're talking about GHK copper. And so any way that we can help to build that up in our body, better. So I was using actual stem cells and actually using GHK copper injectables. When I heard that we could activate this naturally in our body through the patch, I became so excited, because many people don't want to use injectables, and they're much more expensive, and stem cell IVs and injections are very expensive. And the patch is an amazing way that we could keep this going in our bodies every day. So basically, GHK copper is going to help us sleep better, have less pain. Our cognition can certainly be better, and energy levels. And that's what we're looking at for most of us in our bodies, for rejuvenation and for quality of life.
Stem cells are the only cells in our body that are changeable, which means they can change into whatever cell your body needs for repair. And this is why we look the way we looked when we were 20. Our stem cells were working at 100%. They don't start to really go down to 50% until you're 30. And then they go down again by almost 100% by the time you're 60. So it kind of makes sense. I mean, just think about your own life. When you were 20, like, you had no wrinkles, you had no gray hair. I had the unibrow. I don't know how many women had the unibrow. I wish I had it still. And like, the chronic diseases weren't really happening because your body was repairing. So then fast forward, think of yourself now. I'm 55. I don't know how old you guys are all, but put that. Remember what happened at 30, at 40, at 50. God, 50 for me was stage 3 breast cancer. Oops, the chronic disease came. Stem cells weren't repairing. I mean, that's just truth. That what was happening. So what if, doctor, by wearing this patch, we could activate those stem cells to start repairing our body again, like it did when we were young. Is it even possible, doctor? Is this true? It almost sounds science fiction to me.
Well, it does. And stem cells, there are different types of stem cells. And so the stem cells that we look at are mesenchymal stem cells. Those are the stem cells that we have as adults. They're different than the kind of stem cells that certainly are what helps to create the embryo. A stem cell at that level can, make an eye or an ear. We don't have that ability in our body, obviously, which is good, right? But the stem cells are regenerative, very regenerative in our bodies. And so they travel like little honing birds to areas of our body of greatest inflammation. And so that's why we want to work all we can to reduce inflammation so that the stem cells that we are activating can work the best in our body. And so those stem cells can be very rejuvenative. So maybe they'll travel to a joint and can help rejuvenate more cartilage in the knee itself. Maybe we can have enough regeneration that even hearing can be restored for people that may have some autoimmune issues going on, help with our heart, and many of our organs can be restored in certain ways. There's limitations with mesenchymal stem cells, but there's a lot that can happen regeneratively in our body. And so initially when we start the patches, we're doing the repair. And so some people will feel something immediately, pain. The first day I had a greater sense of well-being and less pain. And that night I slept better than I had slept in years. And some people don't have it that quickly. And I tell my patients, you need to be on these patches for every decade of your life, a month for each decade, and give it time. And that's our reparative stage, so that then we can remove into rejuvenative stages a little bit later after we've been doing this for several months. Let's say you're 50 years old and you would have then about 5 months, 1 month for every decade of your life. During that time, we're really doing a lot of repair. So you may not feel that your fatty liver is improving, right? But it's important to keep using these patches because there is a reparative stage, meaning that the stem cells are going to your areas of greatest inflammation. Now, they're going to have reparative stages throughout your life. But initially, there's much to repair, right? We want to get our bodies in order, get the inflammation down. And once then the stem cells have done that work, they can begin to be more rejuvenative. And even in those first few months, there's some rejuvenation there that you feel. But the longer I've been on the patches, the longer I've seen that, I'm finding more and more now rejuvenation, more and more energy, better sleep. As long as our body is having to deal with just like putting out one fire after the other, and the stem cells are, okay, where do we go now? Kind of thing. But if we're eating a good, healthy diet, so we're not constantly re-aggravating our gut and inflaming it, if we're exercising our body as best we can, whether that means, if you're confined to a chair, you're doing isometrics, or you're walking or running or whatever your body allows you to do, and you're always challenging it. And then you're de-stressing, in ways through prayer and devotion. And that's so important to help us learn to de-stress and deal with life. And so all of it together is what then gives our stem cells a chance to really work and rejuvenate. And they're not constantly having to put out fires because we're drinking too much alcohol, or, we didn't get out of the TV chair all day. So it's really important lifestyle, as David Schmidt talks about, and that helps to activate the patches. And I love that word too, rejuvenate. It makes you feel rejuvenated, right? Just to say it.
People want to know the difference between, okay, write this down so you can know these. PRP, bone marrow stem cells, cord blood stem cells, and stem cells called give me a minute, I'm looking at chat, exosomes. Exosomes, of course you know what that is. Okay, so what are all those? And how is the X39 stem cell activation patch different from those four?
Well, the X39 patch is going to stimulate what we call mesenchymal stem cells in our body. And those are our adult stem cells, like I said, that can't make a new head or an eye, but they have some regenerative properties. And the stem cells actually just exude all these wonderful healing chemicals as well, okay? And many of us have heard of embryonic stem cells. We know that's illegal. We don't use embryonic stem cells in the United States, never have. That's the very beginning of how, God put it within us to begin to make a baby, all right? And so those stem cells can make many things. So it's sort of like a tree. You start up here with embryonic and then it moves down. And then we go into, there's multipotent and pluripotent stem cells. They can do some things, but not as much as embryonic, but more than mesenchymal. And then you get to mesenchymal stem cells, which is what we're talking about today. Exosomes are something that is very popular now and being used by some regenerative doctors. And my feeling on that is, so exosomes are a part of the whole matrix of stem cells, but I don't like to isolate exosomes because I think that that God made, literally, this is nature, right? For everything to be in harmony together. And so often to pull something out and then really stick it into people. I've done a lot of research on exosomes, and I do not support using them by themselves. I think they have the potential to be very good, but I think there's also the potential maybe for some harm to go awry because they don't have some of the other matrix to keep them in check. Wow. So we're looking at mesenchymal stem cells in particular. And yeah, feel free to sort of look at it, research, and our bodies are amazing, what they can do, how they can regenerate our brain, our body. Very, very amazing.
Wow. So the education, there's embryonic, which is illegal.
Except for they do a little bit of that sometimes in research and in some other countries as well. But for anybody's use,
illegal. Cord blood is not embryonic, but that is another way you can get stem cells. But that's from after having a baby, the blood of the mother's cord. That also is not legal in the US anymore, but it is legal in other countries. Then we have bone marrow, where you get your own stem cells from bone marrow, although those, if they're not activated, are probably pretty old if you're old. And then we have PRP, where they take the plasma, platelet rich plasma, and they pull that out, spin it, and put it back in. That's your own. So there are, it sounds to me like there's different kinds, and X39 is different than all of these in that you're not putting somebody else's DNA in you. You, through light, are activating your own stem cells, and it sounds like they are the mesenchymal stem cells. Did I get that right?
Yes, and now women can still donate their own cord blood from their baby's birth to cord banks, but we're no longer allowed to use any stem cells from that. The cord banks can't distribute it to other people, and that's not allowed in the United States anymore. But I did want to say one thing about platelet-rich plasma, PRP. So it has a lot of growth factors and can be very effective. But these activating our stem cells and our peptides is just such a much higher plane of growth factors and regenerative factors that it makes sense to, go to the highest way we can regenerate. And again, there's no needles, we're not having to go through procedures. We're not having to pay a lot of money. We're just literally peeling off, 2 little pieces and sticking something on a patch on our body for the day. So to me, it's just amazing. And I always, as a practitioner, look for what is safe and what's going to be effective. We call it efficacious in medicine. And so something that's safe and efficacious, that's what we want. And when the FDA starts their trials, first they do safety. And if they then feel like it's safe, then they move into, is it going to actually be effective? And so we know through the studies and research that's done on stem cells and GHK, that those are amazing substances that the body makes naturally. And we have our research that the patch activates stem cells and X39. So it's just, to me, it's a no-brainer. It's something everybody, can do for themselves.
X39 has a 20-year patent. And if you read the patent, it says X39 activates GHK in the blood, which stimulates stem cells. It's right in the patent. You can't get a patent if the technology doesn't do what it says. So I love that David Schmidt, the owner, inventor, and CEO of this company, has 100 research studies and 100 patents on technology. He loves to invent, and he researches what he invents. Dr. Patti literally has given GHK copper peptide injections 30 days in people's stomachs. She literally has done nasal stem cells for people. So she really understands the category of GHK and stem cells, and that she just went through with us the different types of stem cells and the different ways to get them. The one thing she didn't say is cost. Just so you know, PRP is $2,000. Tony Robbins went to Mexico for cord blood stem cells for $20,000 for an injection, right? So I just want you to see the cost. And so Dr. Patti is so forward thinking. When her patient brought in X39 and said that this could activate stem cells, she didn't go, oh, that's crazy, and not look at it. She said, interesting. And she went and did her research. And now she's wearing the patches, she's sharing the patches, because for literally $100 for a 30-day supply. That's less than a cup of coffee a day to activate your stem cells, non-invasively. What does non-invasively mean?
Well,
and non-transdermal. Those are two words everybody says. Is this non-invasive? Is this non-transdermal? Is this organic? These are questions that people, is this vegan? These are questions that people want to know.
Yeah, and it's good that we can say, yes, pretty much to everything, because this is activating our body's own innate healing ability. And because we just live in such a toxic world, we do need to take some supplements, and we do need to eat healthy, and we do need, in my opinion, to use regenerative techniques. But a transdermal patch has medicine, a drug in it, right? That comes directly into your bloodstream. Sometimes that's important and needed for a patient, but we're not putting any drugs. There's no drugs, there's no chemicals. There's just these little crystals that are sort of cut in different shapes, amino acid, sugar, amino acids. And that's what the center of our patch is right there. And that is what our body puts out, infrared light. And we know that's a healing frequency. We see that with infrared beds, infrared wands. Our physical therapists use infrared light. Chiropractors often use infrared light, acupuncturists, and many of you may have that in your own clinic. But our body naturally has this healing ability of infrared light, and it just gradually sort of exudes from our body out. And when we put that patch on, we block just that specific energy point in our body to deflect that infrared light back into our body, to activate more the pathway for peptides and for stem cells. So it's such a natural way of working.
Let's talk about how we wear this, Dr. Patti. How do people wear this patch?
For the X39 patch, the two places in our body that have been studied through David Schmidt's research specifically are on the back of the neck, on that prominent bone that sticks out on the back of your neck, or 2 finger widths below your belly button. And that's sort of the midline of the body, and that's a really strong energy point. But he says, if you've got a pain, you could put it here. And I've heard people's testimonies where they have a pain with their wrist. My testimony right now is I have a pain with my wrist. This is, oh my goodness, it's helping it so much. So I'm now wearing X39 on my wrist because that's where the pain is. And it goes throughout the whole body. But sometimes if you've got a specific area that is inflamed or painful, putting it there might give it just a little bit more energy, is what he says. But that's the way we start with X39. And all of the patches online, and also with the little booklet you get with them, show you places that you can put the patch to.
So you can put the patch right below the back of your neck, underneath your belly button, 12 hours on to activate and repair, and 12 hours off. So because it's non-transdermal and non-invasive, and it activates us through a light signal, you've got to take time off of the signal, or your body will get used to the signal and it won't work so well. So once again, below the back of the neck, underneath the body, as Dr. Patti says, our whole body is light. So any spot will do. And perhaps you want to pop the spot of pain, or pop the spot of irritation, or maybe a better way to say it, pop the spot that needs a little extra love. It's your body. You know what I mean? Like, work with it. Your body will tell you a lot if you listen. And know that every patch has its own 12-hour clock. Doctor, now that we've understood our stem cell technology and understand that this is the workhorse of the line for LifeWave, this is always your beginning patch. But Dr. Patti loves to go to, and you can write this down, practitioners, so you know where to research, just like Patti does, startx39now.com. There is a tab called patents and studies. She always goes there to research. She also goes to the GHK link to research, which is on that site. There's also 2 great videos on that site. Well, actually 3. One on, it's just 3 minutes, the second video on stem cells, how they work in our product. Down below is David Schmidt, our owner, and he does an 18-minute video on how this technology works and the issues it helps with. And then further down for the doctors is another video where David talks to practitioners, and he really goes over the research. And then at the very bottom of the site, there's a tab that says connect to YouTube LifeWave Health. And you can just go to YouTube and type YouTube search LifeWave Health. Kathy, can you put that in chat for me? And what Dr. Patti does is she just then, when she gets there, that's the LifeWave YouTube channel. She just searches David Schmidt and whatever technology she wants to do a deep dive in. David Schmidt X39, David Schmidt glutathione, David Schmidt Nirvana. And some of the best ones are the ones that are created by LifeWave Connect. And Kathy, I don't know if you got all that, but maybe you could kind of outline that so the doctors could edit, copy, edit, paste. Because I know as practitioners, you're going to want to do a deep dive like Dr. Patti. When I first met Dr. Patti, she's like, I'm listening to all of David's videos on every single technology, because he does 1 hour on at least on every technology he has created. The man is not afraid to educate us.